Hi, my name is Kip Sinclair of Sinclair Law Offices in Port St. Lucie, Florida. I've been representing victims of medical malpractice and their families for more than 30 years now. I also hold a black belt in Judo and Jiu-Jitsu, and I've taught that martial art. So I'm going to talk to you a little bit about medical malpractice and a little bit about personal safety. I'm going to tell you what is not medical malpractice. Many people suffer injuries at the hands of doctors and hospitals and nurses, but not all of those injuries are a result of medical or hospital malpractice. Let me give you a couple of examples. When you go in for surgery, you sign a form called a medical informed consent form. That form lists all of the procedure, all the complications that can happen as a result of that procedure. If those recognized complications happen, it's usually not a result of malpractice. For example, you take a colonoscopy, and if the doctor's doing the colonoscopy and the instrument pokes through your bowel, you need surgery for that. But it's a recognized complication of the procedure. Unless the doctor doesn't notice it and sends you home with that perforation and you have to go in later with serious injuries, then that's medical malpractice. Postoperative infections happen more frequently than anybody would like. However, infections happen. Infections are recognized complications, and usually they're not a result of medical malpractice. If a doctor treats you appropriately but you have a less than adequate outcome, that's not malpractice either, because nobody is going to guarantee a certain result from your treatment. It's best to get these questions about whether it's malpractice or whether it's not malpractice answered by a lawyer who knows medical malpractice law, who can evaluate that and analyze it for you. A little bit about self-defense. Weapons of convenience. First, if you're held up or being robbed, the absolute best thing to do is to give the guy your money. Actually, take out your wallet or purse and toss it on the ground. Make him pick it up. While he's doing that, turn around and make a run for it. If it looks like you're going to be hurt, don't be a victim. Tossing something in the assailant's face is a great way to give you a chance to take off. Pocket change, your eyeglasses, all that'll work fine. Your cell phone. If you have a beverage in your hand, you can either throw it at him or spit a mouthful at him, give you time to turn and run. If you're inside somewhere, what you need to do is to put yourself between your attacker and the door. Use a chair, use a table. That'll give you time to get away. Last-ditch moves. If you really think you're going to get hurt by your attacker, use a glass, use a beer or wine bottle, use a plate. All that'll work on your attacker and give you time to stun him, to get away. Even take off your belt and use the belt buckle on him. Anything it takes. You need to do whatever you need to do to remove yourself from your assailant. And you need to use whatever you need to use to remove yourself from the situation.